1 in 2 people living with chronic pain feel stigmatised by healthcare professionals, and almost 80% are battling mental health issues. That's according to the latest National Pain Survey obtained exclusively by Sky News. Joining us live now is President of the Chronic Pain Australia, Nicolette Ellis. Thank you so much for your time. Are you able to take us through the key findings of the report and what it is that more than 3 million Australians who struggle with chronic pain are battling the most?
Yeah, thank you. Well, it's the leading cause of disability in Australia, and in this National Pain Survey, we actually looked more into the mental and emotional toll of chronic pain. And shockingly, but unsurprisingly, we found that 1 in 2 Australians living with chronic pain experience suicide ideation and self-harm. And I say this is unsurprising because the impact of chronic pain is significant on the individual. It's a leading cause of disability, which means that many people or many Australians find themselves unable to work because of pain. Then again, that impacts their identity, their self-worth, their ability to be with their family and socialise. So you can see that the impacts to Australians themselves is quite tremendous with this condition. And I particularly liken it to where mental health conditions were about 20 years ago, the stigma, the invalidation of the condition, because it's one of those invisible illnesses that people can't.
It is heartbreaking to hear that 1 in 2 feel stigmatised by healthcare professionals. I would have thought by now, by 2023, this trend would be reversed. Why is it?
I think it's a lot to do with the training for health professionals. I myself am I'm a pharmacist, and I can't remember doing any training in chronic pain management. I just sort of found myself in that area because there was such a huge need from the community. And also, I really think that our healthcare system doesn't fully support people who live with chronic pain. So another finding out of the National Pain Survey was that many people don't access mental health care plans or care plans to see a physiotherapist or exercise physiologist. And we really strongly believe that that's linked to the gap fees that are included within those care plans, and also the lack of training or gaps within the healthcare professionals in meeting the needs of people with chronic pain.
How's the rising cost of living impacting those living with chronic pain?
Yeah, well, it hasn't missed the chronic pain community. It's certainly been a huge impact to people with chronic pain. We're seeing that essential items like food and fuel, people are giving up to afford medications and treatments. And on average, people are putting at least over $200 out of pocket towards their own medical treatments.
The report also found that 45% of respondents are self-medicating. How concerning is that?
It's a really concerning trend when you paint that whole picture with suicide ideation included. We've also seen that because of opioid regulations and the pressures to reduce opioid prescribing, that doctors are reaching for combinations of sedative alternatives. And then this is putting patients and Australians at this risk of self-prescribing with alcohol, non-medicinal cannabis and illicit substance use. So to me and to all of the people who volunteer at Chronic Pain Australia, we just see this as a cocktail for disaster.
Do you have any advice for people who are maybe watching this and are battling chronic pain?
Absolutely. We have National Pain Week starting and kicking off on Monday 24th and going till the 30th. And you can look at the Chronic Pain Australia website. If you just type that into Google, you'll be able to find us. It's really important that you connect in with your community, find people who also live with chronic pain. There's lots of different resources out there. There's a wonderful organisation called Australian Pain Management Association who also provide a phone line called PainLink for people who are in crisis living with chronic pain. So there are services out there. Connect with your people, with your community, and be loud about your condition. We really need to be explaining to community health professionals what this condition is doing and win the hearts and minds of our community, Australians, and hopefully politicians to see better funding for chronic pain in Australia.
Nicolette Ellis, President of Chronic Pain Australia, thank you so much for your time this afternoon. We appreciate it.
Thank you.